gold medalist, record winner, Olympic record holder. He can run a 9.58 second 100-meter dash, so cover about 33 feet per second. And the average person can run about 100 meters in about 14 seconds. So you'd have to sprint pretty hard to get to the police officer or the person in threat. And now there's even rulings or court rulings that distance doesn't really even matter. Based on this court case, the Buchanan versus City of San Jose, the Ninth Circuit Court, there was a case where a Mr. Philip Watkins, from a distance of 130 feet, ran at full stride towards officers while holding a knife. They took several steps backwards and gave repeated commands for him to stop, but when he reached approximately 55 feet from the officers, they opened fire. And then, even after getting shot, he traveled another 37 feet toward the officers before falling with the knife still clutched in his hand. And then this was a case of, this was the patient, he was actually trying to do suicide by cop, which was what they found out. And the ruling was that the officers were cleared by the DA. I'm going to go over some other cases of similar instances of bad outcomes. So case number one, this is Thomas versus Fullerton Police Department. And this happened in 2011, and officers received a false report that someone was vandalizing cars near the Fullerton Transportation Center. And officers found Kelly Thomas. He looked a little bit transient and had untreated schizophrenia. And interestingly enough, he was the son of a former sheriff deputy. He was kind of, his father said, I couldn't really control him, so I just let him wander around a bit. And then officers claimed at the time he was uncooperative and resistant to orders. So 6 officers subdued Mr. Thomas, tased him 5 times, and had used the blunt end of a flashlight to beat him unconscious. Mr. Thomas died 5 days later at UC Irvine due to his brain not receiving oxygen from compression of his thorax. And then the officers, Manuel Ramos and Corporal Jay Cicinelli, seen in the video beating, pleaded not guilty and were acquitted. And then Fullerton City Council, because the father kind of knew how to navigate the legal system a bit, he did a lawsuit, and the city agreed to pay a $4.9 million settlement of a wrongful death lawsuit on the condition that no one admits any fault as part of the settlement. Case number 2. Takar Smith et al. Versus City of Los Angeles et al. This happened on January 2nd, 2023 in Los Angeles. Takar Smith, a 47-year-old man with schizophrenia, was talking to himself and making nonsensical remarks. So his wife was worried. Sassy Smith ended up walking to a nearby Los Angeles police station to get help. So 6 armed officers suddenly entered her apartment, and Sassy was told to wait outside. She wasn't part of the de-escalation. And they did try to de-escalate. In the video, you can see that they tried to de-escalate. And then eventually, Mr. Smith went into the kitchen and then grabbed a knife. The police attempted to use a taser. Mr. Smith dropped the knife, but then picked the knife up again. Police fired several rounds into Mr. Smith when he picked up the knife. And the police commission ruled this LAPD shooting of a mentally ill man was not justified. And the case was recently settled, and it was about $6 million in settlement. Case number 3, Victor Perez. This is a recent one that happened in April 5th in 2020, this year, 2025, in Idaho. Police reported to calls that an intoxicated man was chasing someone with a knife, but the actual reality was that family members were trying to get the knife away from a 17-year-old Victor Perez, who suffered from autism and was nonverbal. He also suffered from cerebral palsy and could only stagger when he walked, so he actually struggled with a walking gait. And then he was staggering towards the police with the knife, and despite police being behind a chain-link fence and the family's claim that he could not jump the fence, they proceeded to shoot Victor against the pleas of the family. And he later died after he showed no brain activity and was taken off of life support. And this is the photo. As you can see, it's like they're responding to like a war zone. They're bunkering down here. 4 people behind the fence, and the person walking towards them, of course, they said he couldn't jump the fence. So what about Sorry, I said Mr. Yong. It's Dr. Yong Yang. So my apologies. So what about sorry? It's Dr. Yang, and what about Mr. Yong Yang? This is his mother presenting to the Los Angeles Board of Police Commissioners this April. Been uploaded online, but we did get word that the police commissioners did indicate no wrongdoing of the police that were involved in the case. And the other question, do all victims receive payouts? The Yang family was actually up in Sacramento to help and support a bill, AB 572, which includes having the officers who are interrogating family members to identify themselves. So I ended up meeting other family members that are also doing this advocacy movement with them. And from what I found out, it's pretty sad that not all the families receive payouts. I gave you examples of cases where families did receive payouts, but in this, in not all the time, in the families that showed up. And what I found out talking with the families was that it really is dependent on the current district attorney and what they do as an assessment. I'm going to hand over the presentation to Dr. Cho.
Thank you, Dr. Ha. I'm going to speak about effective strategies and interventions law enforcement officers could use during mental health crisis. This was already touched on in the previous sections. And effective strategies and interventions include three main approaches. One is a crisis intervention team model, which was developed in Memphis and incorporates pre-booking problem-solving approach, which trains officers to be first responders. They use de-escalation, negotiation, transport, and referrals or arrests if needed. Partnerships with local mental health facilities and providers is necessary for this approach. A second way to, for law enforcement to handle mental health crisis is to use co-responders, which are mental health providers that are embedded with law enforcement. And now, after the Kelly Thomas incident, the Fullerton Police Department now uses co-responders or mental health trained clinicians when they're going out to investigate mental health crises. The third way is incorporates mental health providers. You can have mobile response teams. They're called psychiatric emergency treatment providers. They have various acronyms, and they're used in some communities throughout the country. There's also a variant of crisis intervention teams model. There's one called the Crisis Response Intervention Training, and it's an evolution of the original CIT model. It's a 40-hour training program with 18 models of varying size that can be customized to the local needs of a community. And it trains officers in background information on different populations, including veterans, homeless individuals, and incorporates role-playing scenarios, instruction and presentation of symptoms of persons with mental illness and developmental disabilities, and the utilization of de-escalation techniques and referral to the appropriate mental health agencies. So, evidence for crisis intervention teams. The results look promising, but data is limited, still in the initial stages. Also depends on the quality of the studies and the data that exist. Most of the studies that looked at CIT models and their efficacy studied mainly the effects on the attitudes of officers who were trained and their responses. Actual arrests really did not go down in some of the studies, so there's still time and a need for improvement in implementation. And it's also dependent on the geographic location and how it's used, what is the quality of the training, and what mental health resources are available in that community, as well as the demographics and the socioeconomic status of most of the people in that area. So as I mentioned, there's mixed results. In Akron, Ohio, the implementation of a CIT model did not result in reduction in arrests, but it did increase the numbers of referrals to emergency rooms or other mental health treatment agencies by officers. And another problem with CIT is that there's no quality assurance oversight. There needs to be a better accountability program to look at ways to standardize them and make them more uniform across the country. The International Association of Police Chiefs has recognized the public health issue of unfavorable outcomes of interactions between police and individuals with mental illness and developmental disabilities. So they are promoting CIT. They've also encouraged implementation of other programs like mental health first aid, which is less intensive than CIT and requires only 8 hours of training. And this model can be used to train more officers if there's if there's not enough resources to train at least 50 or 75%. They also stress the importance of identifying resources, collaborating with mental health providers, and building partnerships with the major stakeholders in the community, such as patients, consumer advocates, experts, and mental health providers. So, de-escalation techniques that can be used, basically it's just being more kind, showing respect, showing empathy, developing emotional intelligence, speaking in a clear, calm voice, engaging in active listening, building rapport, finding some common ground, offering choices, not using orders, using distraction, trying to contain the situation, distract the individual. How many times have you seen police officers trying to de-escalate people? Has anyone seen anyone de-escalate? Okay. And then there's less lethal weapons that can be used by police, including paintballs, rubber bullets, foam projectiles, beanbag guns. These can still be lethal if the head, neck, or other vulnerable areas are hit. Pepper spray or pepper ball guns, and they're used within a range of 0 to 60 feet. Tear gas, flashbang grenades can also still cause injuries and be lethal. They can cause burns, and they can cause blindness from the light and hearing loss from intense sounds. And tasers and batons. So I just want to point out that even though these are less lethal weapons, they can still inflict significant injury and cause deaths. And here is a photo of an armored police vehicle car door. And you can see the different caliber bullets. The largest is the 12 gauge slug from a shotgun. That's all about 18 millimeters in diameter. And then you see the other bullets. The smallest is like the 5.56 millimeter bullet on the farthest left-hand side. You see a 9 millimeter in the top left. And then the 40 caliber, if you divide by 100, you'll get it in inches, so it's 0.4 inches, which is about 10 millimeters in diameter. The 38 caliber is about 0.38 inches, or about 9 millimeters in diameter, and then the 45 caliber is about 11 millimeters. And so you can see the back. Doesn't look like it really corresponds to the bullets. Maybe that the trajectory of the bullets changed once it entered the door, but usually in humans the trajectory is kind of straight. So there are some communities that are implementing training for police. City of Sacramento and the Sacramento Police Department began implementing extensive de-escalation and using less lethal options training for officers beginning when they start in the police academy. And these trainings are conducted by mental health professionals. If you're interested, there's a YouTube video showing a successful de-escalation of a man wielding several knives by the Sacramento Police Department. And in law enforcement, around the globe in different countries. There are several countries where the police do not carry guns while they're on patrol on the streets. One of the main ones is the United Kingdom, except for Northern Ireland. Southern Ireland, Republic of Ireland, they do not carry guns either when they're patrolling the streets. Norway, New Zealand, Iceland, Botswana, Malawi, and about 3/4 of the Pacific Islands, the police there do not carry guns. Usually in these areas, they only carry guns for specialized units like the SWAT teams. So despite having unarmed law enforcement officers in the community, in general, these countries have the lowest levels of crime in the world. Iceland has one of the lowest crime rates in the world. Botswana has a lower crime rate compared to other African countries, and it has been trending downward over the past several years. Ireland has a low crime rate despite the fact that only 25% of the police, detectives, and special units carry guns. And I think we also mentioned South Korea, right? Has low, I think South Korean police carry guns, but there's been low levels of deaths. Do I need to? Oh, okay. Okay. Annual rates of total fatal police violence and fatal police shootings. This might be unreported, but the U.S. is number 3 in violence, fatalities by police, and then it's number 1 in fatal police shootings. And this is another slide of the U.S. So then there was an op-ed published by Philip Stinson, who's an associate professor in criminal justice, and he recommended that state and local officials hire special prosecutors in private practice to investigate the police. And again, you can see that there's many cases where officers are not convicted, even though the case has been decided. There's still high numbers of non-convictions. And I'm going to conclude with saying that I think there needs to be a change in the attitude of police in some areas in the United Kingdom. 82% of police expressed a desire not to carry guns. They consider themselves to be guardians or protectors, not criminal hunters. David Harris, professor of law at the University of Pittsburgh, stated that it would be better if officers thought of themselves as guardians rather than warriors, and stop thinking of people as enemies while focusing on maintaining a community's peace and tranquility. So warrior policing is the attitude that emphasizes a military combat style approach, envisages police officers as soldiers battling crime. It employs an us versus them mentality, and it uses coercive interactions and increased use of lethal force. Arrests and citations are prioritized over addressing the underlying social issues of crime. This leads to adversarial relationships with the public and undermines the trust. Whereas guardian policing emphasizes community engagement, collaboration, building trust, mediation, and problem solving. And this will improve relationships with the public, increase trust, and increase citizen cooperation, and contribute to a proactive approach to crime prevention. Thank you.